In today's video, we will cover 6 crucial aspects of rheumatoid arthritis: its hidden causes, early warning signs, foods that worsen the condition, foods that help manage it, daily habits for joint health, and bad habits that silently damage your joints. Have you ever felt a lingering joint ache or stiffness? Have you ever wondered if this is more than just a passing pain? Are these the early signs of rheumatoid arthritis? Today, let me teach you the early signs of rheumatoid arthritis, one of the most common forms of arthritis that I see in my practice, rheumatologist on call. RA is an autoimmune disease, which means your immune system, instead of protecting you, starts attacking your own body. Unlike osteoarthritis, which results from wear and tear, RA causes inflammation that can lead to permanent joint damage. Early detection is crucial because the sooner we catch RA, the better we can prevent long-term damage. However, RA isn't always easy to recognize because its symptoms often mimic other conditions. Some people don't even experience joint pain in the early stages, making diagnosis even trickier. That's why understanding the subtle early signs is so important. It could be the key to preventing lifelong complications. Are you ready to uncover the warning signs? Let's dive in. One of the earliest and most overlooked signs of RA is a persistent low-grade fever. Unlike normal fevers caused by infections, this fever tends to come and go without an obvious reason. You might notice that by late afternoon or evening, you feel slightly warm, fatigued, and unwell. This is because RA causes chronic inflammation, which triggers your immune system to react as if it's fighting an infection. A fever alone might not raise suspicion, but when combined with joint stiffness, fatigue, or unexplained pain, it's worth paying attention to. RA-related fevers are usually below 100.4 degrees Fahrenheit, meaning they don't reach dangerously high levels. However, persistent low-grade fevers without any flu or infection could indicate something deeper happening in your body. If this happens frequently, especially alongside other symptoms, don't ignore it. Speak to your doctor. Detecting RA early can prevent long-term damage to your joints and organs. So, if you have unexplained fevers, consider them a potential red flag for RA. Do you ever wake up feeling just as tired as when you went to bed? RA-related fatigue is much more than just being sleepy. It's a deep, overwhelming exhaustion. Even with a full night's rest, you may struggle to focus, feel drained, and lack motivation. This happens because RA triggers widespread inflammation, which forces your body to work overtime to fight itself. Your energy levels drop, your muscles feel weak, and even simple tasks like walking up the stairs feel exhausting. Fatigue in RA is unpredictable. Some days you might feel okay, while others you can barely function. This fatigue can also impact your mental health, leading to brain fog, irritability, and even depression. Many RA patients describe it as a heavy, unshakable exhaustion that limits their daily life. If you're constantly tired, especially alongside joint pain or stiffness, it's time to take action. Ignoring this symptom could mean delaying treatment, allowing the disease to progress further. Have you ever experienced numbness, tingling, or weakness in your hands? Carpal tunnel syndrome, or CTS, is often linked to repetitive hand movements, but rheumatoid arthritis, or RA, can also be a hidden cause. When RA causes inflammation in the wrist, it compresses the median nerve, leading to pain and numbness. Unlike regular CTS, which often affects just one hand, RA-related CTS usually happens in both hands at the same time. This can make simple tasks, like typing, gripping objects, or even buttoning a shirt, frustrating and painful. RA patients with CTS often experience symptoms worse at night, waking up with stiff, tingling fingers. If left untreated, nerve compression can lead to permanent hand weakness and loss of dexterity. Many patients mistakenly undergo surgery for CTS, not realizing that RA is the real culprit. Before considering surgery, it's crucial to check for underlying RA as the root cause. If you experience bilateral CTS symptoms, consult a rheumatologist to rule out RA. Does it feel like your eyes are always dry and irritated? Do you constantly need to sip water because your mouth feels like a desert? RA-related inflammation can affect the lacrimal and salivary glands, leading to chronic dryness. This condition, called secondary Sjogren's syndrome, can make blinking uncomfortable and eating difficult. Patients often describe a sensation of grittiness or burning in their eyes, making it hard to focus. A dry mouth can increase the risk of gum disease, cavities, and difficulty swallowing. Left untreated, this can lead to corneal damage and long-term dental problems. If artificial tears and drinking water constantly don't seem to help, your dryness may be RA related. Ignoring this symptom can lead to permanent damage to your vision and oral health. If you're experiencing persistent dryness, consult a doctor to explore the possibility of RA. Have you noticed small, red pinpoint rashes on your legs? RA can cause vasculitis, an inflammation of the blood vessels that results in these unusual skin changes. These rashes are not itchy or painful, but they signal that inflammation is spreading beyond the joints. Another common skin-related sign of RA is RA nodules, firm lumps under the skin near joints. They often appear on the elbows, hands, and feet, and can sometimes be mistaken for lipomas or cysts. These nodules are painless but can grow larger over time, leading to discomfort and limited movement. Approximately 7% of RA patients develop nodules, and their presence often indicates more severe disease progression. Some patients also develop Raynaud's phenomenon, where fingers turn white or blue in cold weather. These vascular symptoms are all signs that RA is not just affecting the joints, but also the entire body. If you notice persistent rashes or nodules, it's essential to seek medical evaluation. Do you wake up feeling like your joints are locked in place? Morning stiffness is one of the hallmark signs of rheumatoid arthritis, often lasting longer than an hour. Unlike stiffness from overuse or aging, RA stiffness doesn't improve quickly with movement. Patients describe it as a feeling of being frozen, where bending fingers or getting out of bed is painful. This happens because overnight, inflammation builds up in the joints, making them rigid in the morning. Some people even need hot showers or gentle stretching just to start their day. Morning stiffness in RA differs from osteoarthritis, where stiffness usually eases within 30 minutes. If your joints feel stiff for hours every morning, it's a red flag that shouldn't be ignored. Early treatment can prevent long-term joint damage and improve mobility. Are you losing weight without trying and have no explanation for it? Weight loss in rheumatoid arthritis happens because chronic inflammation speeds up metabolism and burns muscle mass. Your body mistakenly thinks it's under attack, using extra energy to fuel the immune response. As a result, you might notice muscle wasting, a weaker grip, and reduced endurance. Many RA patients experience loss of appetite, making it harder to maintain a healthy weight. Ongoing inflammation also disrupts nutrient absorption, leading to deficiencies in essential vitamins. If you're dropping weight and experiencing fatigue or joint pain, RA could be the hidden cause. This isn't a good weight loss, it's your body struggling with an autoimmune battle. Unexplained weight loss combined with pain, stiffness, or swelling should always be checked. A simple blood test can help identify inflammatory markers and diagnose RA early. Did you know rheumatoid arthritis doesn't just affect your joints, it can also impact your lungs? Inflammation from RA can cause scarring in the lung tissue, leading to difficulty breathing. Some patients develop a condition called interstitial lung disease, which makes the lungs stiff. You might notice shortness of breath, a dry cough, or chest discomfort without any clear reason. This happens even if you don't have a history of smoking or asthma. RA-related lung issues can start before joint symptoms appear, making early detection crucial. In some cases, lung nodules may develop, which are often harmless but require monitoring. Chronic inflammation in the lungs increases the risk of infections like pneumonia. If you're frequently out of breath or experiencing a persistent cough, don't ignore it. A lung function test or chest scan can help determine if RA is affecting your respiratory system. Are you struggling with bloating, nausea, or frequent stomach pain? Rheumatoid arthritis can cause inflammation in the gut, leading to digestive discomfort and food intolerances. Some people with RA also develop IBS-like symptoms, such as diarrhea or constipation. Chronic inflammation can weaken the gut lining, making it harder to absorb nutrients properly. Many RA patients have a higher risk of stomach ulcers, especially if they take NSAIDs for pain. In severe cases, RA can contribute to autoimmune gut disorders like Crohn's disease. An imbalance in gut bacteria, known as dysbiosis, is common in RA and worsens symptoms. Eating an anti-inflammatory diet rich in fiber, probiotics, and omega-3s can help reduce gut issues. If your digestive problems persist, it might not just be diet-related, it could be RA at work. A gastroenterologist can assess whether your gut issues are linked to autoimmune inflammation. Have you felt more anxious, forgetful, or mentally drained lately? Rheumatoid arthritis doesn't just affect your body, it can also impact your brain and mental health. Chronic pain and inflammation contribute to higher levels of stress hormones like cortisol. This can lead to brain fog, making it harder to concentrate, remember things, or stay sharp. Depression is twice as common in RA patients because of constant fatigue and lifestyle changes. Anxiety often accompanies RA due to uncertainty about symptoms, flare-ups, and treatment. Inflammatory molecules called cytokines affect brain function, leading to mood swings. Some RA medications can also have mental side effects, worsening anxiety or depressive symptoms. If you feel emotionally or cognitively different, it's important to discuss this with your doctor. Managing RA holistically, with medication, therapy, and lifestyle changes, can improve brain health. Rheumatoid arthritis is more than just joint pain. It's a full-body disease that can affect multiple organs. Catching RA early can prevent irreversible damage, reduce disability, and improve daily life. At Rheumatologist on Call, we specialize in diagnosing and treating RA before it progresses. We use advanced testing, genetic assessments, and personalized treatment plans for each patient. Many people suffer for years without answers, delaying treatment and worsening their condition. If you recognize any of these 10 warning signs, don't wait. See a rheumatologist as soon as possible. The sooner RA is identified, the better your chances of controlling it and living pain-free. Let's now uncover the real causes of rheumatoid arthritis. There's a hidden cause of arthritis, especially if it's in these knuckles right here, the knuckles of the first digit and the second on either side, and the knee joint. But this arthritis could be in other joints as well, and that hidden cause is iron overload. Let me explain. Hemochromatosis is a condition where the body absorbs too much iron, leading to toxic accumulation. This iron overload gets stored in the joints, causing inflammation, stiffness, and pain over time. Unlike other minerals, iron has no natural elimination process, so excess amounts keep building up. Many cases of hemochromatosis are genetic, but it can also develop due to diet or medical procedures. Blood transfusions, excessive iron supplements, and certain fortified foods can accelerate iron overload. One of the earliest symptoms of this condition is arthritis, particularly in the hands and knees. People with hemochromatosis often get misdiagnosed with rheumatoid arthritis or osteoarthritis. Left untreated, it can lead to organ damage, diabetes, heart disease, and severe joint degeneration. A simple blood test measuring ferritin and transferrin saturation can confirm iron overload. If you're experiencing joint pain along with fatigue, bloating, or liver issues, iron might be the culprit. The liver plays a crucial role in storing and regulating iron levels in the body. When iron accumulates excessively, it becomes toxic to liver cells, leading to inflammation and fibrosis. Conditions like fatty liver, hepatitis, or excessive alcohol use make iron overload even worse. A damaged liver cannot properly regulate iron, allowing even more accumulation in the body. Over time, this can result in cirrhosis, liver failure, and an increased risk of liver cancer. Medications such as acetaminophen, Tylenol, can weaken the liver, worsening iron toxicity. Diets high in processed carbs and sugars contribute to fatty liver, which impairs iron metabolism. Common symptoms of liver dysfunction include abdominal bloating, nausea, yellowing of the skin, and fatigue. Strengthening liver health through fasting, reducing sugar intake, and consuming cruciferous vegetables is essential. If your liver is overloaded, your ability to manage iron will be severely compromised. Many people unknowingly consume high amounts of iron daily, leading to a slow buildup. Iron is naturally found in red meat, organ meats, shellfish, and dark leafy greens. However, iron-fortified processed foods, like cereals and breads, contribute to excessive intake. Many multivitamins contain synthetic iron, elemental iron, which is absorbed too quickly. Pairing high iron foods with vitamin C enhances iron absorption, which can worsen overload. On the other hand, consuming calcium, coffee, or fiber with iron-rich meals reduces absorption. People at risk of iron overload should avoid iron supplements and iron-fortified foods. Cooking with cast iron pans can also increase iron intake and worsen the condition. Balancing dietary iron with fiber, healthy fats, and polyphenol-rich foods helps regulate levels. Understanding how diet influences iron absorption is crucial for long-term health. Excess iron is not just harmful to joints. It also disrupts insulin function and blood sugar levels. When iron builds up in the pancreas, it damages insulin-producing cells, leading to diabetes. Studies show that people with iron overload have a higher risk of insulin resistance. Iron contributes to glycation, a process where sugar binds to proteins, causing tissue damage. This leads to stiff joints, increased inflammation, and accelerated aging of the body. High-carb diets combined with iron overload create a toxic cycle that fuels inflammation. People who eat red meat with starchy foods like potatoes or pasta are at greater risk. Intermittent fasting helps reduce insulin resistance and regulate iron levels naturally. If you struggle with joint pain, weight gain, and blood sugar issues, iron overload may be involved. Addressing both iron levels and blood sugar balance is key to improving metabolic health. Iron is an essential mineral, but in excess, it becomes fuel for harmful bacteria and pathogens. Certain bacteria thrive in iron-rich environments, leading to frequent infections and inflammation. People with iron overload often experience weaker immune function and higher infection risks. Excess iron also contributes to chronic inflammation, increasing the risk of autoimmune diseases. Studies suggest that too much iron disrupts gut health, leading to leaky gut syndrome. A compromised gut can trigger systemic inflammation, worsening joint pain and arthritis symptoms. Since iron accumulates in various tissues, it can also damage the heart, pancreas, and brain. Lowering excess iron can help restore immune function and reduce inflammation. Strategies like blood donation, consuming polyphenols, and liver detoxification are effective. Maintaining optimal iron levels supports a strong immune system and overall health. Phytic acid is a natural compound found in nuts, seeds, whole grains, and legumes. It binds to minerals like iron, zinc, and magnesium, reducing their absorption in the gut. While phytic acid is often labeled as an anti-nutrient, it can benefit those with iron overload. By inhibiting iron absorption, phytic acid prevents excessive buildup in the body. Supplementing with inositol hexaphosphate, IP6, a concentrated form of phytic acid, may help. Other iron-reducing foods include green tea, turmeric, and polyphenol-rich fruits. Balancing iron intake with fiber and plant-based foods can help manage absorption naturally. If iron overload is a concern, phytic acid-containing foods can be a useful dietary tool. However, those with mineral deficiencies should be cautious about excessive phytic acid intake. Moderation is key to reaping the benefits without compromising overall nutrition. Since the body cannot excrete iron efficiently, donating blood is one of the best ways to lower iron levels. Each blood donation removes approximately 250 milligrams of iron, preventing toxic buildup. Regular blood donors have been shown to have a lower risk of heart disease and metabolic disorders. Bloodletting has been used for centuries as a treatment for iron-related conditions. Men and postmenopausal women are at higher risk of iron overload since they don't lose blood naturally. Donating blood not only helps manage iron levels, but also supports circulation and cardiovascular health. If blood donation is not an option, doctors may recommend therapeutic phlebotomy. People with iron overload should consult a physician to determine a safe donation frequency. Lowering iron through blood donation can relieve joint pain, improve energy, and enhance overall well-being. It's a simple yet powerful strategy for maintaining balanced iron levels in the body. Excess iron doesn't just affect joints and organs, it's also a major risk factor for heart disease. When iron builds up in the heart, it causes oxidative stress, inflammation, and arterial damage. This can lead to conditions like high blood pressure, arrhythmias, and even heart failure. Iron overload is linked to higher cholesterol levels and increased risk of blood clots. Studies suggest that men who don't lose blood regularly have a higher risk of heart disease. Reducing iron through blood donation can help lower cardiovascular risks significantly. Antioxidant-rich foods like berries, green tea, and turmeric help counteract iron's oxidative damage. If you have a family history of heart disease, checking your iron levels is crucial. Lowering iron and improving cardiovascular health can reduce the risk of heart-related complications. Taking action now can protect your heart and overall well-being in the long run. Did you know excess iron may contribute to neurodegenerative diseases like Alzheimer's and Parkinson's? Iron accumulates in the brain, leading to oxidative stress, inflammation, and neuronal damage. Research shows that people with iron overload are at greater risk of cognitive decline. Excess iron may contribute to brain fog, memory loss, and difficulty concentrating. Iron-related oxidative damage can increase amyloid plaque buildup in Alzheimer's disease. Polyphenols from green tea, coffee, and dark chocolate help neutralize excess iron in the brain. If you experience unexplained cognitive issues, checking iron levels might provide answers. Maintaining optimal iron levels supports mental clarity and long-term brain health. Taking preventative measures now can reduce the risk of neurological disorders later in life. Brain health starts with understanding and managing your iron intake effectively. Managing iron overload isn't just about avoiding iron-rich foods, it's about supporting the body's ability to regulate iron effectively. One of the best ways to lower iron is through regular blood donation, which helps remove excess iron naturally. Consuming more fiber-rich foods like vegetables, nuts, and seeds can help bind iron and reduce absorption. Incorporating polyphenol-rich foods such as green tea, berries, and turmeric can help neutralize excess iron. Phytic acid found in legumes and whole grains can also reduce iron absorption when consumed in moderation. If you eat red meat, pairing it with leafy greens and healthy fats instead of starches can minimize iron overload risks. Avoiding iron-fortified foods, excessive vitamin C with meals, and iron cookware can also prevent unnecessary accumulation. Supporting liver health through intermittent fasting, reducing sugar intake, and taking liver-supporting herbs is essential. For those with severe iron overload, working with a doctor to monitor ferritin levels and consider medical treatment is key. Taking these proactive steps can help prevent joint pain, organ damage, and the long-term risks of iron toxicity. If you've been struggling with joint pain, stiffness, or unexplained inflammation, iron overload might be an overlooked factor. Many people assume their arthritis is purely due to aging or genetics, but the real cause might be hidden in their iron levels. Excess iron doesn't just affect the joints. It can lead to serious health issues like liver disease, diabetes, and heart problems. Fortunately, there are simple and effective ways to manage iron levels and protect your long-term health. Avoiding unnecessary iron supplements, donating blood, and making dietary adjustments can make a significant difference. If you suspect iron overload, getting a ferritin blood test is a good starting point to assess your levels. By taking control of your iron intake and supporting liver health, you can reduce inflammation and improve overall well-being. Let's dive into the 10 worst foods that people with rheumatoid arthritis should avoid. Did you ever wake up after a party or restaurant feeling like your joints are on fire? Are your RA symptoms suddenly worse with unbearable pain, swelling, and stiffness? Have you ever wondered if the food that you eat the night before has any connection with the sudden worsening of RA? This video will answer these questions. I will teach you the foods that can cause an RA flare-up, from the least toxic to the worst foods. I am Dr. Marlene, a rheumatologist with more than 12 years of experience who treats patients with RA every day. RA is an autoimmune disease that affects millions of people all around the world. It can cause pain, stiffness, and a lot of joint deformities if it is not diagnosed in time and if it is not treated appropriately. But besides medication, which is actually very advanced today, my patients will always ask me about natural ways of treating arthritis. Over the last 10 years, I have constantly researched this topic to see if nutrition and other lifestyle interventions are helpful. The answer is yes. Nutrition is scientifically proven to help people with RA. Only now, after 10 years of talking about this topic, I have seen the American College of Rheumatology release lifestyle guidelines to support lifestyle interventions for patients with RA. But even those are not very strongly recommended. I am here to tell you that eating the right foods will decrease pain, swelling, stiffness, and inflammation, and will heal your gut. Number 10. Nightshade vegetables. Let me share a fascinating story about one of my patients who thought she had developed RA. A patient came to me with all the classic RA symptoms: joint pain, swelling in her hands, and hours of morning stiffness. We got lab tests, and they were negative for RA. It was clear to me that she was having inflammation. After talking to her about her diet, she told me she had been eating a lot of tomatoes. She had grown them in her garden and didn't want them to go to waste. She was consuming them daily, in salads, stews, and sauces. I suggested she eliminate tomatoes for a month and then return for a checkup. When she came back 6 weeks later, her symptoms were completely gone. Nightshade vegetables include tomatoes, potatoes, except sweet potatoes, eggplants, bell peppers, and hot peppers. These vegetables contain solanine, a compound that can trigger inflammation in sensitive individuals. While not everyone with RA needs to eliminate nightshades, research suggests that about 20% of arthritis patients report improved symptoms when avoiding these foods. My advice? Try a 30-day elimination diet to see if nightshades are affecting your symptoms. Number 9. Artificial sweeteners. Many of my patients tell me they have made a healthy choice by switching to sugar-free foods. But is this really healthy? Let's look at what science says about artificial sweeteners. They disrupt gut microbiome balance, leading to increased intestinal permeability or leaky gut. They increase inflammatory markers in the body. Some artificial sweeteners, particularly aspartame, have been linked to increased cancer risk and autoimmune diseases like RA. Aspartame and sucralose are commonly found in diet sodas, sugar-free snacks, and processed low-calorie products. These chemicals confuse the body's metabolism, increasing sugar cravings and leading to more inflammation. Instead of choosing artificial sweeteners, opt for natural alternatives like honey or maple syrup in small quantities. Even better, train your taste buds to enjoy less sweetness overall. My advice? Cut back on artificial sweeteners and see if your RA symptoms improve. Did you know that 65% of the global population has some form of lactose intolerance? Here's what research tells us about dairy and RA. Casein, the protein in dairy, can trigger inflammatory responses in some people. Lactose intolerance can cause gut inflammation, leading to worsened RA symptoms. Commercial dairy often contains added hormones and antibiotics, which disrupt the immune system. However, not all dairy is bad. Studies show that certain dairy products, such as plain yogurt, natural kefir, and unprocessed cheese, can actually benefit some people. The key is to eat minimally processed dairy if you include it in your diet. My advice? If you suspect dairy is worsening your RA, try eliminating it for a month and see how you feel. I'm not saying you should never drink alcohol, but moderation is key. Studies show that people in Mediterranean countries who drink 1 glass of red wine per day have better health outcomes. Red wine is high in polyphenols and antioxidants, which can help reduce inflammation. However, excessive alcohol intake can disrupt the gut microbiome, leading to more inflammation. It can interfere with common RA medications like methotrexate. It can increase liver stress when combined with medications. It can disrupt sleep patterns, which worsens inflammation. It can increase inflammatory markers by up to 30%. The consequence? More joint pain and stiffness for people with RA. My advice: limit alcohol intake and stick to 1 glass of red wine per day if you choose to drink. One of the most common questions I get from my RA patients is gluten bad for me? The answer depends on your body's sensitivity. For those with gluten intolerance or sensitivity, gluten can cause intestinal damage, leading to systemic inflammation that worsens joint pain and stiffness. Inside the gut, gluten is broken down by an enzyme called protease, but some people lack enough of this enzyme, leaving gluten undigested. This triggers an autoimmune response, leading to increased inflammation and discomfort. Unfortunately, standard medical tests do not always detect gluten sensitivity unless you have full-blown celiac disease. However, scientific studies show that RA patients who adopt a gluten-free diet experience fewer flare-ups and lower inflammation levels. The best way to determine if gluten is affecting you is through an elimination diet. Cut out gluten for 6 months and track any changes in your symptoms. If there's no improvement, you can reintroduce gluten to see if it makes a difference. Instead of gluten-containing grains, try quinoa, brown rice, buckwheat, or gluten-free oats, which are healthier alternatives. Many people think that cooking with vegetable oils like canola oil, soybean oil, corn oil, and sunflower oil is a healthy choice, but these oils are highly processed and inflammatory. They contain excessive amounts of omega-6 fatty acids, which disrupt the balance between omega-3 and omega-6 fats, leading to chronic inflammation in the joints. Additionally, these oils go through a harsh refining process that involves chemical solvents and high temperatures, creating harmful byproducts that increase oxidative stress in the body. Over time, this damages your cells, making RA symptoms worse. One study found that people with high omega-6 intake had more severe joint pain compared to those with a balanced fat ratio. Instead, swap these harmful oils for extra virgin olive oil, which contains powerful anti-inflammatory compounds like oleocanthal. Avocado oil is another excellent option for high-heat cooking, while cold-pressed coconut oil can provide a stable alternative for frying. By reducing seed oils in your diet, you can significantly decrease inflammation and support joint health naturally. Did you know that high red meat consumption is linked to worsening RA symptoms? Studies show that frequent intake of red and processed meats increases the levels of C-reactive protein, an inflammatory marker linked to joint pain. Processed meats in particular, such as bacon, sausages, and deli meats, contain nitrates and preservatives that further drive inflammation. In a study involving over 1,700 RA patients, those who followed a Mediterranean diet, which includes less red meat and more fish, vegetables, and whole grains, experienced a 21% lower risk of developing RA. Furthermore, excess consumption of grilled or fried red meat leads to the production of advanced glycation end products, which contribute to inflammation and oxidative stress. If you enjoy eating meat, the best approach is to limit red meat to 1 to 2 servings per week and choose grass-fed beef, which has higher levels of anti-inflammatory omega-3 fats. Additionally, consider replacing red meat with wild-caught fish, which provides beneficial omega-3 fatty acids that help reduce joint pain and stiffness. Number 3. Refined carbohydrates. Refined carbohydrates such as white bread, white pasta, white rice, and sugary cereals may taste delicious, but they are one of the worst triggers of inflammation in the body. These foods are stripped of their natural fiber and nutrients, causing rapid spikes in blood sugar. This, in turn, leads to insulin resistance, which promotes weight gain and joint pressure, worsening RA symptoms. A 2020 study showed that RA patients consuming a high refined carbohydrate diet experienced more frequent flare-ups, higher pain levels, and an increased risk of cardiovascular diseases. Additionally, these foods have a high glycemic index, meaning they fuel chronic inflammation and increase the production of pro-inflammatory cytokines. The best way to avoid these harmful effects is by switching to whole grains like quinoa, brown rice, oats, and buckwheat, which provide fiber and essential nutrients to support gut health. If you struggle with sugar cravings, try incorporating healthy fats and proteins into your meals to maintain stable energy levels and reduce the desire for processed carbs. Number 2. Salt. Salt is an essential mineral, but excessive sodium intake can wreak havoc on RA symptoms. A 2015 study involving 18,000 people found that consuming more than 3.5 grams of salt per day significantly increased the risk of developing RA. The reason is that too much salt triggers immune system overactivity, leading to chronic inflammation in the joints. It also disrupts the function of T regulatory cells, which are responsible for controlling inflammatory responses in the body. A 2021 study confirmed that people with high sodium intake had increased joint pain, swelling, and higher blood pressure levels. Many people don't realize that hidden salt is present in everyday foods like processed snacks, canned soups, frozen meals, and restaurant dishes. Instead of consuming excessive table salt, switch to natural seasonings such as garlic, turmeric, ginger, and herbs, which offer additional anti-inflammatory benefits. Additionally, drinking plenty of water can help flush out excess sodium and reduce water retention in swollen joints. Reducing salt intake not only helps manage RA, but also improves overall cardiovascular health. Number 1. Sugar. Sugar is one of the biggest drivers of inflammation and should be the number 1 food to eliminate if you have RA. The average person consumes 57 pounds of sugar per year, which is 10 times more than people did 100 years ago. A 20-year study involving 100,000 women found that drinking just 1 soda per day increased the risk of developing RA by 63%. The reason? Sugar spikes blood glucose levels, causing insulin resistance, weight gain, and inflammation. It also fuels the production of advanced glycation end products, or AGEs, which accelerate joint damage and stiffness. Another problem is that sugar is hidden in processed foods, including breads, sauces, salad dressings, energy drinks, and breakfast cereals. The best approach is to gradually reduce sugar intake instead of quitting cold turkey, as sugar cravings can be as addictive as cocaine. Switching to natural sweeteners like honey or dates in moderation can help, but the ultimate goal is to train your body to crave less sugar altogether. RA is a painful and challenging condition, but small dietary changes can make a huge impact on your symptoms. By avoiding gluten, seed oils, red meat, refined carbs, salt, and sugar, you can significantly reduce inflammation, improve joint function, and enhance your overall well-being. Many of my patients who made these changes reported fewer flare-ups, less pain, and better energy levels. Remember, you don't have to change everything overnight. Start with 1 or 2 adjustments and gradually build healthier habits. As for the foods that help with joint inflammation, they are as follows. Using these foods in your everyday life will improve your pain, swelling, and inflammation. And there is science to support what I say. 1. Berries. Berries, such as blueberries, strawberries, and blackberries, are packed with powerful antioxidants that help reduce inflammation. They contain flavonoids, quercetin, and vitamin C, all of which combat oxidative stress and support joint health. A 2017 study on rheumatoid arthritis patients found that those who consumed berries regularly had less pain and stiffness. Berries help lower levels of C-reactive protein, a marker of inflammation in the body. Their high fiber content promotes gut health, which is crucial in reducing overall inflammation. Additionally, berries contain ellagic acid, a compound that protects cartilage and prevents joint deterioration. Studies show that eating 1 cup of berries daily can significantly improve inflammatory conditions. Other enzymatic fruits, such as papaya, pineapple, and mango, contain natural anti-inflammatory enzymes like bromelain and papain. You can enjoy berries in smoothies, yogurt, or oatmeal for an easy and delicious health boost. Vegetables like spinach, kale, Swiss chard, Brussels sprouts, and asparagus are rich in antioxidants and vitamins that help fight inflammation. They contain vitamins A, C, K, and E, which protect cells from oxidative damage. Spinach in particular has been shown to significantly reduce inflammation in arthritis patients. These greens are also loaded with magnesium, a mineral that helps relax muscles and reduce joint stiffness. Sulforaphane, a compound found in cruciferous vegetables, blocks inflammatory pathways and prevents joint damage. Studies indicate that people who consume more leafy greens experience less joint pain and swelling. The high fiber content in these vegetables supports gut microbiota, which plays a key role in regulating immune responses. To maximize their benefits, eat them raw in salads, sautéed with olive oil, or blended into smoothies. Adding at least 2 servings per day can make a noticeable difference in inflammation levels. Legumes, including beans, lentils, chickpeas, and edamame, are rich in plant-based proteins, fiber, and essential minerals that reduce inflammation. Their high fiber content supports a healthy gut microbiome, leading to lower levels of inflammatory markers. Legumes are also packed with B vitamins, iron, and magnesium, which are essential for joint and muscle health. A diet rich in legumes has been linked to a reduced risk of chronic inflammatory diseases, including rheumatoid arthritis. The polyphenols and flavonoids found in legumes act as natural antioxidants, helping to fight free radicals. Because legumes regulate blood sugar levels, they prevent insulin spikes, which are linked to increased inflammation. Studies show that Mediterranean populations consume up to 23 grams of legumes daily, significantly more than the 5 grams consumed by Americans. Incorporating legumes into your diet can help reduce stiffness and pain in arthritis patients. Try adding black beans to salads, lentils to soups, or chickpeas to hummus for an easy, nutritious meal. Fatty fish like salmon, mackerel, sardines, trout, and herring are among the best sources of omega-3 fatty acids, which have powerful anti-inflammatory effects. These fish contain EPA and DHA, 2 types of omega-3s that help reduce joint stiffness and pain. Studies show that rheumatoid arthritis patients who consume at least 2 servings of fatty fish per week experience less swelling and better mobility. Research published in Annals of the Rheumatic Diseases found that regular fish consumption is linked to lower disease activity. Omega-3s help block inflammatory molecules and reduce the need for pain medications like NSAIDs. If you don't like fish, you can take a high-quality fish oil supplement to get similar benefits. Unlike processed vegetable oils, which trigger inflammation, fish balances the omega-3 to omega-6 ratio, preventing excessive inflammation. The best ways to prepare fish include grilling, baking, or steaming to retain its nutrients. Adding just 2 servings of fish per week can significantly improve arthritis symptoms. Nuts like walnuts, almonds, cashews, pistachios, and pecans are excellent sources of healthy fats, fiber, and antioxidants. They provide monounsaturated and polyunsaturated fats, which help lower inflammatory markers in the body. The pre-dimed study from 2013 found that eating 30 grams of mixed nuts daily reduces the risk of inflammation-related diseases by 30%. Nuts are also packed with magnesium, selenium, and vitamin E, all of which protect joints from oxidative stress. Despite their high calorie content, nuts do not contribute to weight gain due to their fiber and protein content. Walnuts in particular contain alpha-linolenic acid, a plant-based omega-3 that fights inflammation. Studies suggest that people who consume nuts regularly experience less joint pain and stiffness. Eating just 1 handful of nuts per day can help improve joint function and overall health. Try adding nuts to oatmeal, yogurt, or salads for a delicious and nutritious boost. Chia seeds are a superfood loaded with plant-based omega-3 fatty acids, fiber, and essential minerals, making them ideal for fighting inflammation. Just 1 ounce or 28 grams of chia seeds contains 10 grams of fiber, which helps reduce inflammatory responses by promoting gut health. Omega-3s in chia seeds work similarly to fish-based omega-3s, reducing joint pain and stiffness. They are also high in calcium, phosphorus, and magnesium, essential for maintaining strong bones and cartilage. Studies suggest that consuming chia seeds daily can improve joint flexibility and mobility in arthritis patients. These tiny seeds absorb liquid and form a gel, which slows digestion and helps regulate blood sugar levels. Because of their high antioxidant content, chia seeds also protect against oxidative stress, which worsens inflammation. You can sprinkle them over yogurt, add them to smoothies, or mix them into oatmeal. Start with 1 to 2 tablespoons per day to experience their full benefits. Olive oil is a powerful anti-inflammatory food thanks to its high levels of oleic acid and polyphenols. It contains oleocanthal, a compound with effects similar to ibuprofen, helping reduce joint pain and stiffness. Studies show that people who follow a Mediterranean diet rich in olive oil experience less inflammation and better joint mobility. Unlike vegetable oils, which promote inflammation, olive oil provides healthy monounsaturated fats that support heart and joint health. A study in the Journal of Nutritional Biochemistry found that consuming 2 tablespoons of olive oil daily significantly lowers inflammatory markers in arthritis patients. To get the best results, choose extra virgin, cold-pressed, and unfiltered olive oil. Olive oil can be used in salad dressings, drizzled over vegetables, or mixed into hummus. Making olive oil a daily part of your diet can improve joint health and reduce inflammation naturally. Whole grains like quinoa, brown rice, buckwheat, and gluten-free oats are excellent sources of fiber, vitamins, and minerals. Unlike refined grains, whole grains help lower inflammation by stabilizing blood sugar levels and supporting gut health. A diet rich in whole grains has been linked to lower levels of C-reactive protein, a key inflammatory marker. Whole grains are also high in B vitamins, magnesium, and selenium, which are essential for joint function and energy production. Research shows that people who consume at least 3 servings of whole grains daily experience less stiffness and joint pain. Because they are slow-digesting carbohydrates, whole grains provide long-lasting energy and help maintain a healthy weight, reducing stress on the joints. One study found that replacing refined grains with whole grains reduced inflammation markers by 38%. Some of the best whole grains to include in your diet are quinoa, millet, amaranth, and wild rice. Try incorporating whole grains into your meals by making grain bowls, using whole grain bread, or adding oats to your breakfast. Fermented foods like yogurt, kefir, sauerkraut, kimchi, and kombucha are packed with probiotics, which support a healthy gut microbiome and reduce inflammation. Scientists have discovered that gut health is directly linked to the immune system, meaning that improving gut bacteria can lower inflammatory responses in the body. A study in the journal Frontiers in Immunology found that people with autoimmune diseases like RA have a disrupted gut microbiota, which fermented foods help restore. Probiotics help produce short-chain fatty acids, which lower inflammation and improve digestion. In addition to probiotics, fermented foods contain B vitamins, antioxidants, and enzymes that aid in nutrient absorption. A 2021 study showed that individuals who consumed fermented foods daily experienced a significant decrease in inflammatory markers. Kefir and yogurt contain lactobacillus and bifidobacterium, 2 powerful bacteria that support immune health. Try adding a serving of fermented foods to your meals to promote gut balance and reduce inflammation. Simple ways to enjoy fermented foods include adding kimchi to rice bowls, drinking kombucha, or eating yogurt with berries. Spices like turmeric, garlic, and ginger are powerful natural anti-inflammatory agents that have been used for centuries. Turmeric contains curcumin, a compound with strong anti-inflammatory properties that blocks inflammatory cytokines and enzymes. Studies have shown that curcumin supplements work as effectively as NSAIDs in reducing arthritis pain and swelling. Garlic is packed with sulfur compounds, which help inhibit inflammatory pathways and boost immune function. A study in Arthritis Research and Therapy found that garlic consumption was associated with lower levels of inflammatory markers. Ginger contains gingerol, a bioactive compound that reduces muscle pain, joint stiffness, and swelling. Research suggests that daily ginger supplementation can significantly reduce arthritis symptoms within 12 weeks. In a study published in the Journal of Medicinal Food, ginger was found to reduce pain levels by 40% in osteoarthritis patients. You can add these spices to soups, stir-fries, teas, or even take them as supplements for maximum benefits. Instead of using excess salt, try seasoning your food with these natural anti-inflammatory spices. By incorporating these top 10 anti-inflammatory foods into your daily meals, you can naturally reduce pain, swelling, and stiffness. Research has proven that diet plays a crucial role in managing inflammation and autoimmune diseases like arthritis. Small changes like switching from refined grains to whole grains, adding more fatty fish, and consuming probiotics can make a huge difference in your overall health. If you struggle with inflammation, start by adding 1 or 2 of these foods each week and see how your body responds. Which of these foods do you already eat? Which ones will you start adding to your diet? Let me know in the comments. Let's dive into the 8 daily habits that are silently destroying your joints and causing knee osteoarthritis, joint pain, and stiffness. Sitting for extended periods reduces blood circulation, leading to stiffness, swelling, and joint pain. When you sit too much, your muscles weaken, providing less support to your joints. Studies show that people who sit for more than 6 hours a day have a higher risk of knee osteoarthritis. Long hours of inactivity increase pressure on the lower back, hips, and knees, accelerating joint degeneration. Additionally, sitting incorrectly with a slouched posture puts extra strain on your spine and joints. To prevent this, stand up and stretch every 30 minutes. Walking or even simple leg movements can help maintain flexibility. If your job requires long sitting hours, use an ergonomic chair and proper posture support. Consider using a standing desk to reduce joint stress. Make movement a regular part of your routine to keep your joints healthy and pain-free. Many people believe that resting is better for joint pain, but inactivity actually worsens stiffness and increases pain. Without regular movement, muscles around your joints weaken, making it harder to support your body. A lack of exercise also leads to weight gain, putting extra pressure on the knees, hips, and lower back. Low-impact exercises such as swimming, walking, and yoga can strengthen muscles without damaging joints. Research shows that people who exercise regularly have less joint pain and better mobility as they age. Weight training can also help improve bone density, reducing the risk of arthritis. However, high-impact workouts like running on hard surfaces can be harmful if done excessively. To protect your joints, focus on low-impact, joint-friendly exercises. Aim for at least 30 minutes of moderate exercise daily to keep your joints strong and flexible. Excess body weight increases pressure on your joints, especially your knees and hips. Every extra pound you carry adds 4 times more stress on your knees when you walk. This extra pressure accelerates cartilage breakdown, leading to faster joint degeneration. Studies show that losing just 10% of body weight can significantly reduce knee pain and improve mobility. Being overweight also increases inflammation, worsening conditions like osteoarthritis and rheumatoid arthritis. A high BMI is linked to higher levels of joint pain and stiffness in both men and women. If you are overweight, focus on a healthy diet, portion control, and regular physical activity. Avoid crash diets, as rapid weight loss can also harm joints. Even a small weight loss can make a huge difference in reducing joint stress and pain. Maintaining a healthy weight is one of the best ways to protect your joints long-term. The way you sleep directly affects your joints, especially your neck, shoulders, and knees. Sleeping in the wrong position can cause misalignment, leading to morning stiffness and joint pain. If you sleep on your stomach, your spine stays twisted for hours, putting stress on your back and neck. Side sleepers without proper pillow support may wake up with hip and knee pain. The best sleeping position is on your back or side with a pillow between your knees for better alignment. A good quality mattress and pillow can help keep your joints supported while you rest. If you suffer from chronic pain, consider using an orthopedic pillow or a body pillow. Research shows that poor sleep quality increases pain sensitivity, making joint discomfort worse. Prioritize comfortable, joint-friendly sleep habits to wake up feeling refreshed and pain-free. Footwear plays a crucial role in joint health, especially for your knees, hips, and lower back. High heels, flat sandals, or unsupportive shoes can misalign your posture and increase joint stress. Studies show that wearing high heels regularly accelerates knee osteoarthritis by putting extra pressure on the knees. Flat shoes without proper arch support can cause joint instability, leading to hip and lower back pain. Always choose well-cushioned, supportive shoes with good shock absorption. If you have joint pain, consider using orthopedic insoles to reduce pressure on your knees. Walking or running in worn-out shoes can also contribute to joint pain over time. Your shoes should be replaced every 6 to 12 months, depending on usage. Proper footwear ensures better posture, balance, and reduced joint strain for long-term joint health. Slouching or hunching over while sitting or standing increases strain on your joints. Poor posture misaligns the spine, causing chronic pain in the neck, shoulders, and lower back. Studies show that people who sit with bad posture for long hours are at a higher risk of developing arthritis. A curved spine places extra pressure on discs, muscles, and ligaments, leading to joint stiffness. Using phones or laptops for long periods can strain your neck and shoulders, causing tech neck syndrome. To fix this, maintain a straight back, shoulders relaxed, and feet flat on the floor. Keep your computer screen at eye level to prevent neck strain. If standing for long hours, distribute your weight evenly between both feet. Practicing good posture habits daily will prevent long-term joint damage and discomfort. Hydration is crucial for joint lubrication and flexibility. Cartilage is 80% water, and dehydration reduces its ability to cushion joints properly. When joints are not well hydrated, they become stiff, inflamed, and more prone to damage. A lack of water also increases the risk of gout and arthritis flare-ups. Studies show that drinking at least 8 glasses of water daily can improve joint mobility and reduce pain. Dehydration also leads to muscle cramps and joint stiffness, making movement uncomfortable. If you're physically active, you need even more water to compensate for fluid loss. Herbal teas, coconut water, and water-rich fruits also help maintain hydration levels. Making water intake a priority keeps your joints healthy and well lubricated. Many people ignore joint pain until it becomes severe, but early symptoms should never be overlooked. Minor discomfort is often a warning sign of underlying joint issues, such as cartilage wear, inflammation, or muscle imbalance. Ignoring the pain and continuing with harmful activities can lead to chronic arthritis, stiffness, and permanent joint damage. Studies show that early intervention with physical therapy, stretching, and lifestyle changes can prevent long-term damage. Pain is your body's way of saying something is wrong, so pay attention to it. Simple changes, like modifying your workouts, using joint-friendly techniques, and resting when needed, can help. If pain lasts more than a few days, consult a doctor or physiotherapist for a joint health checkup. The sooner you address joint pain, the better your chances of recovery and long-term mobility. Your daily habits have a direct impact on your joint health, either protecting or destroying them. By identifying and eliminating these 8 damaging habits, you can prevent joint pain, stiffness, and arthritis before it becomes a lifelong problem. Small changes lead to big results. Focus on moving more and sitting less, maintaining a healthy weight, choosing supportive footwear and good posture, staying hydrated and eating anti-inflammatory foods, listening to your body and avoiding overuse injuries. If you've been experiencing joint pain or stiffness, now is the time to make a change. Start adopting joint-friendly habits today and protect your mobility for a lifetime. Now let's move to the 10 daily habits that protect your joints and strengthen your bones. Your joints and bones support your entire body, allowing you to move, walk, and stay active. But if you don't take care of them, you risk stiffness, pain, and even long-term damage. The good news? By making small changes in your daily routine, you can keep your joints strong and pain-free for years to come. Let's dive into the 10 powerful habits that will help you protect your joints and build stronger bones. One of the best ways to protect your joints is to keep them moving. Exercise strengthens muscles around the joints, reducing strain and preventing injuries. Low-impact activities like swimming, cycling, and walking help keep joints flexible without causing wear and tear. Strength training also builds bone density, reducing the risk of osteoporosis. According to studies, people who exercise regularly have better joint mobility and lower chances of developing arthritis. Even simple habits like stretching every morning or taking a short walk improve blood flow to your joints. But remember, overtraining can be just as harmful, so listen to your body and give yourself enough rest. If you're new to exercising, start slowly and gradually increase intensity to avoid injury. Always include warm-ups and cool-downs to prevent stiffness and injuries. Your diet plays a huge role in joint and bone health. Eating foods rich in calcium, vitamin D, and omega-3 fatty acids helps keep bones strong and reduces inflammation. Leafy greens like spinach and kale, dairy products, fatty fish, and nuts are excellent choices. Omega-3 fatty acids found in salmon, flax seeds, and walnuts help reduce joint stiffness and pain. Avoid processed foods and excessive sugar, as they increase inflammation and weaken bones. Studies show that people who follow a Mediterranean diet, rich in whole foods and healthy fats, experience less joint pain and better mobility. What you eat today affects your joints tomorrow. Choose wisely. Try adding more turmeric and ginger to your meals, as they have natural anti-inflammatory properties that support joint health. A balanced diet isn't just good for your joints, it's essential for your overall longevity. Your joints rely on synovial fluid, a natural lubricant that helps them move smoothly without friction. When you're dehydrated, your body produces less of this fluid, making joints feel stiff and sore. Drinking plenty of water keeps your cartilage hydrated and prevents breakdown over time. Aim for at least 8 glasses of water a day and increase intake if you're active or live in a hot climate. Sugary drinks like soda and energy drinks can actually dehydrate you faster, so stick to water, herbal teas, or natural fruit-infused drinks. A hydrated body equals happy, pain-free joints. If you struggle to drink enough water, try setting reminders or using a marked water bottle to track your intake. Your joints will thank you for every sip you take. Your body repairs and rebuilds cartilage, bones, and tissues while you sleep. Poor sleep increases inflammation, leading to joint stiffness and pain. Aim for 7 to 9 hours of quality sleep every night to give your joints the recovery time they need. Studies show that people who don't get enough sleep have higher levels of inflammatory markers linked to arthritis and joint damage. Create a healthy bedtime routine by limiting screen time, keeping a cool, dark room, and avoiding caffeine before bed. Restorative sleep reduces joint pain, boosts healing, and keeps your bones strong. If you have trouble sleeping due to joint pain, try using a supportive pillow and mattress designed for joint relief. Good sleep isn't a luxury, it's a necessity for strong, pain-free joints. Believe it or not, your choice of footwear directly affects your joint health. Wearing unsupportive shoes, like high heels or flat, worn-out sneakers, can put excess stress on your knees, hips, and lower back. Over time, this can lead to joint misalignment, pain, and even osteoarthritis. Instead, choose well-cushioned, supportive shoes that absorb shock and provide good arch support. If you spend a lot of time standing, invest in orthopedic insoles to protect your joints from unnecessary strain. Your feet are your foundation. Take care of them, and your joints will thank you. If you have flat feet or overpronation, consult a podiatrist to get custom orthotics for additional support. The right shoes today can prevent major joint problems in the future. Bad posture puts constant stress on your joints, leading to chronic pain and stiffness. Sitting hunched over a desk or slouching while standing misaligns your spine and weakens the muscles that support your joints. Over time, poor posture can contribute to joint degeneration, back pain, and even arthritis. To fix this, be mindful of how you sit, stand, and walk throughout the day. Keep your shoulders back, spine straight, and feet flat on the ground. If you work at a desk, use an ergonomic chair and take frequent breaks to stretch. Good posture reduces strain on your joints and helps you move pain-free for years to come. Regularly doing posture-correcting exercises like yoga or Pilates can help strengthen your core and improve alignment. Strong muscles act as a natural cushion for your joints, reducing impact and preventing injuries. Weak muscles force your joints to take on more pressure, increasing the risk of wear and tear. Strength training exercises like bodyweight workouts, resistance bands, or weightlifting help build muscle mass and joint stability. Focus on strengthening your core, legs, and back to improve balance and protect your knees and hips. Even light resistance exercises, when done consistently, make a huge difference in preventing joint pain and stiffness. If you're new to strength training, start with bodyweight squats, lunges, and resistance band exercises before progressing to heavier weights. Smoking and drinking too much alcohol can silently destroy your joints. Studies show that smokers have a higher risk of rheumatoid arthritis and joint inflammation. Nicotine reduces blood flow to your joints, making it harder for them to repair damage. On the other hand, excessive alcohol weakens bones by interfering with calcium absorption, leading to osteoporosis. It also increases inflammation, making arthritis symptoms worse. Cutting back on smoking and alcohol can significantly improve joint flexibility, reduce stiffness, and protect your bones. If you need help quitting, there are many support groups, therapies, and lifestyle changes that can make the process easier. Protecting your joints is about making smart choices today for a healthier future. One of the simplest and most effective ways to care for your joints is hot and cold therapy. Heat therapy relaxes muscles, increases blood flow, and reduces stiffness. Try using a warm towel, heating pad, or a hot bath to ease joint pain. Cold therapy, on the other hand, reduces swelling and inflammation. Applying an ice pack for 15 to 20 minutes can help after physical activity or if your joints feel inflamed. Many athletes and arthritis patients use contrast therapy, alternating between hot and cold treatments to keep joints flexible and pain-free. Always listen to your body and use these therapies as part of your daily joint care routine. Excess weight puts a lot of pressure on your joints, especially your knees, hips, and lower back. Every extra pound you carry adds 4 times the stress on your knees. Over time, this leads to joint damage, increased pain, and a higher risk of osteoarthritis. Losing even a small amount of weight can significantly reduce joint pain and improve mobility. The best way to maintain a healthy weight is a balanced diet combined with regular exercise. Strength training, walking, and eating nutrient-rich foods keep your joints strong and inflammation low. Small lifestyle changes, like avoiding processed foods, reducing sugar intake, and staying active, can make a huge difference. Keeping a healthy weight means less pain, better movement, and a lower risk of arthritis in the future. Your joints carry you through every movement, so take care of them. Over the past few videos, we've explored hidden causes of arthritis you didn't know, early signs of arthritis you should never ignore, 10 worst foods that trigger arthritis and increase pain, 10 best foods to fight arthritis and reduce inflammation, daily habits to protect your joints and improve flexibility, bad habits that destroy your joints without you noticing. By adopting these healthy habits, you can reduce pain, prevent arthritis, and keep your bones strong for years to come. Remember, move often and exercise smart, eat an anti-inflammatory diet, stay hydrated and get enough sleep, maintain good posture and use proper footwear, listen to your body and take action early. Your joints are for life. Protect them starting today. What was your biggest takeaway from this series? Comment below and share your thoughts. Don't forget to like, subscribe, and turn on notifications so you never miss a video.